ആരോഗ്യ സംബന്ധമായ വിവരങ്ങളുമായി ഇനി ലൈഫ് ആൻഡ് ഹെൽത്തിൽ റോസ് വടകര.
കോവിഡ് പുതിയ ജനിതക മാറ്റം സംഭവിച്ച വൈറസുകളുമായി മുന്നോട്ട് കൊണ്ടിരിക്കുകയാണ്. ലോകത്തിനു മുന്നിൽ എന്താണ് ചെയ്യേണ്ടതെന്നറിയാതെ നമ്മളെല്ലാവരും പകച്ചു നിൽക്കുകയാണ്. ഹാൻഡ് വാഷിങ്ങും സ്ഥിരമായി മാസ്ക് ധരിക്കുന്നതുമെല്ലാം നമ്മുടെ ജീവിതത്തിൻ്റെ ഭാഗമായി കഴിഞ്ഞിരിക്കുന്നു. ഈ അവസരത്തിൽ സ്കിൻ റിലേറ്റഡ് ആയിട്ടുള്ള പ്രശ്നങ്ങളാണ് ഇന്ന് നമ്മൾ ചർച്ച ചെയ്യുവാൻ ഉദ്ദേശിക്കുന്നത്. ഇതിനായി നമ്മളോടൊപ്പം ചേരുന്നത് 20-ലേറെ വർഷങ്ങളായി ഡെർമറ്റോളജിസ്റ്റായി പ്രവർത്തിക്കുന്ന ഡോക്ടർ നാദിയ സിദ്ധു ആണ്. ഡോക്ടർ നാദിയ, വെൽക്കം ടു ലൈഫ് ആൻഡ് ഹെൽത്ത്.
Thank you so much. Thank you for having me today.
Today we all are living in a world of sanitizers, hand washing, and this has created a lot of concerns like dryness or cracking in our hands. Doctor, currently in your practice, how do you treat these issues that is related to hand hygiene practice?
Yeah, certainly COVID has created a lot of issues in the medical field in our human community, and certainly hand washing, dermatitis, and issues related to too frequent hand washing is a big problem. We call it a hand hygiene related dermatitis when people are excessively washing their hands, which is important for reducing communicable diseases. And certainly the irritant dermatitis that comes from frequent hand washings has been an enormous complaint in our clinic. And the way we address it is to try to have people use emollients immediately after they're washing their hands. So as soon as they finish washing their hands, to put on a Vaseline-based, preferably a Vaseline-based emollient, to make sure they're re-protecting their hand after it's being stripped of a lot of the natural protective oils, et cetera, from that frequent hand washing. Washing with lukewarm water as opposed to hot water is something that can be helpful. And using alcohol-based cleansers when they're not visibly dirty is another way to kind of to try to diminish some of that irritant dermatitis. Certainly, we have a population of people who are actually having irritations from the alcohol-based hand sanitizers. So it's really about trying to minimize everything, using gloves as much as possible. So our clinic is heavily stocked with latex-free gloves, and we try to use that almost continuously in the office. And that, I think, is a big preventer of needing to frequently wash the hands.
COVID-19 and other related mutations has been evolving in past couple of years. In your work experience, what are some of the skin manifestations or issues that you have seen in your practice, doctor?
Yes, from COVID itself, from the infection of SARS-CoV-2, the primary skin manifestations are a diffuse rash, a maculopapular rash, and then COVID toes, which is sort of a vascular effect on the distal extremities, urticaria or hives. There is a livido reticularis-like reaction. It's almost like a lacy purpley color to the skin. There's a shingles type reaction that also we have seen, pityriasis rosea. And then there in children, there's a multisystem inflammatory syndrome, MISC. It's an erythematous polymorphic rash that occurs with some firm induration, affecting hands and feet, the oral mucosa, conjunctivitis. It's a Kawasaki's-like disease. So this was very concerning, and that pediatric population, again rare, but these do occur.
What are the current priorities in dermatology research and clinical practice as the COVID-19 pandemic progresses?
Yes, of course. And the biggest thing right now, or one of the big things, is the use of biologics. So biologics are immunomodulators, and we use them heavily in dermatology for psoriasis, for example, psoriatic arthritis. And the use is much more broad now, including things like alopecia areata, alopecia totalis, for a lot of inflammatory skin conditions, including autoimmune skin conditions. Biologics are playing an increasing role, and we need to understand mostly about inflammation. These medications that decrease inflammation need to be tested to see their effects and their possible beneficial effects in the cascade of inflammatory reactions that occur with COVID virus. And so I think there's very exciting research that's going in on that, and hopefully we'll get more treatments for COVID, which hopefully is where we'll focus more of our efforts on actually treating the condition in the patients who get it. And this is an area of research that we need to spend a little more time on.
കൊറോണ വൈറസും അതിനോടനുബന്ധിച്ച് ഡെർമറ്റോളജി ഇഷ്യൂസുമാണ് ഇന്ന് നമ്മൾ ചർച്ച ചെയ്തത്. ഇതിനെക്കുറിച്ചുള്ള വിവരങ്ങൾ ഏവർക്കും ഉപകാരപ്പെട്ടു എന്ന് പ്രതീക്ഷിക്കുന്നു. വീണ്ടും കാണാം അടുത്തയാഴ്ച മറ്റൊരു വിഷയവുമായി. Thank you, Dr. Nadia, for your time with us on Life and Health.
Oh, you're very welcome. Thank you so much. Be safe. Take care.
US വീക്ക്ലി റൗണ്ടപ്പിന്റെ ഈ എപ്പിസോഡ് ഇവിടെ പൂർത്തിയാകുന്നു. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും asianetnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 732-429-9529 എന്ന വാട്സപ്പ് നമ്പറിലൂടെയോ ഏഷ്യനെറ്റ് US വീക്ക്ലി റൗണ്ടപ്പ് എന്ന ഫേസ്ബുക്ക് പേജിലൂടെയോ ദയവായി ഞങ്ങളെ അറിയിക്കുക. വീണ്ടും കാണാം അടുത്തയാഴ്ച. നന്ദി, നമസ്കാരം.
Namaskaram. Attorney Steve Griffiths here. Greetings to the Malayali community and blessings during these challenging times. We understand the unique character of the Kerala community, and we are here to serve your legal needs for all injuries, accident, and wrongful death cases. Call us when you need help. All consultations are confidential. Namaste.
Hello, my name is Jeremy Carden, here with Citywide Mortgage, servicing Illinois and now Florida. We're committed to serve our community, and we deliver what we promise. Call us today.